Okay, so today we're gonna do a basic walkthrough of our hygiene rooms that we use for our hygiene appointments for our patients. First thing you wanna do is you're gonna wanna familiarize yourself with your drawers. Every hygiene room will have a standard hygiene drawer. You're gonna find a few different things in here. First things first is that you're gonna find two different prophy angles. We have our standard gray one here with a green cup. This is used for children without braces, whereas our blue one here is used for braces. You can see the difference in the prophy cup by one being flat and this one being pointed. Okay. We're also gonna have our suctions. We have two different types in here. One of them is a saliva ejector, okay? The other being a high vac. You'll also see floss threaders in here. These are used for our infant exams, or also known as our lap to lap. You'll also have our different types of prophy paste. This is a toothpaste that we're gonna use to actually brush the child's teeth. You'll also find fluoride, okay? We'll go over the amount to use per patient in our hygiene video. For our other flossers for kids older, we have this here. The way to use this is you grab in between, pull, and pull it down. That way, if we are using gloves that are dirty, we're not contaminating it, only this here. That saliva ejector that we found in our hygiene drawer will actually go on what's called a low vac, okay? The low vac is a smaller section that allows us to use for our patients. We'll also have things like a high vac, which we would use for that big white suction. However, in our hygiene appointments, we don't typically use this, just the low vac here. If you want to look down on the ground here, we do have what's called a rheostat, also known as the pedal, okay? This will attach to our prophy angle, which is on our unit right here. Now this unit has a few different things that you'll notice. First thing being is that this is our prophy angle here, okay? This is attached to that pedal that I just showed you down on the floor. And what we do with this is we're gonna take a prophy out here, okay? This will attach onto here. There's a little notch there and a little bit opening there. This will slide right on, and now your prophy is properly attached to your prophy angle. Now, if you look down at the pedal, and as I press this with my foot, this will actually spin. This is how we actually prophy a patient's teeth. As for the other things on this unit, typically in a hygiene appointment, the only other thing you're really gonna need to focus on is this guy here. This is our air water, okay? This has two buttons on it. First one being air on the right, and on the left is water. In our standard hygiene trays, we're gonna have three instruments: a mirror, an explorer, and an air water tip. Now this air water tip is actually gonna attach to this part here. However, before we do that, I wanna show you that there's two notches on one end, and a little spout on the other. The two notches will actually insert into this part here, and you wanna push it in all the way so that the spouts are not visible to the eye. Now, when you press the two buttons, first being the right, it's gonna be air that comes out. Okay. Now the second will be water. The other thing that you will notice in all of the hygiene rooms is that we do have different drawers that have different types of toothbrushes that we'll give our patients, okay? For patients that only have primary dentition, you're gonna see these smaller toothbrushes here, okay? As for our kids with mixed dentition, you're gonna see these larger toothbrushes that are multicolored. In their appointment bags that you'll give at the end of the appointment, you're gonna have normal reach floss and a toothpaste. Whereas in those primary ones, you're gonna have floss picks for those kids.